I'm so pleased that you're here today to join us. And let's remember, we're all working towards the same goal. We're all working to make sure that cancer prevention, as we know it, is getting to the point where we're controlling the disease.
A bit about the report. So it's been about 10 years in total in the making. The researchers analysed over 17 different cancer types, involving about 50 million people globally, and 3.5 million of those were diagnosed with cancer.
Here we have a charity looking to ask questions that matter to people and do it as a public service. To be a healthy weight is the single most important statement. If you want to be a healthy weight, then be physically active. Eat a diet that's rich in whole grains, vegetables, fruits and beans. Limit the consumption of fast foods and other processed foods high in fat, starches or sugars. Limit the consumption of red and processed meat. Limit the consumption of sugar-sweetened drinks. Limit alcohol consumption. Do not use supplements for cancer prevention. For mothers, breastfeed your baby if you can. And after a cancer diagnosis, well, the best advice that we can give you is follow our recommendations. These aren't individual statements, they come together as a package. We are convinced that if people are able to capture this package of behaviors in their life, their risk of cancer will be reduced.
This is not about ideology. It's not about making up things. It's what does the evidence say? And the evidence is very clearly summed up in these 10 recommendations.
But one of the striking things about global cancer is that it's not randomly distributed around the world. So here you can see maps of higher and lower incidence of cancers, and they all show remarkable variation around the world. But they don't show the same variation around the world. And there must be a reason for that lack of randomness. And that's likely to be to do with what the causes are. So the causes of that variation must be something in the environment.
If you ask me tomorrow to produce this table, the numbers will be different. And the reason is that today, the part of the team that is not here is still looking in the reference manager databases and is updating the information, and we will be ready when needed to produce a new report for WCRF, because this is the cover.
So there are a number of ways that I think we can improve things in the future. Firstly, I think we're going to make much more advances in electronic technologies. So, for example, wearable technologies like smartwatches to measure physical activity, but also other smart-based solutions to measure things like alcohol, smoking, and diet.
Certainly, it's plausible to think that cancer as a long lasting process of disease development has its roots already early in life, perhaps in childhood or adolescence.
You can exercise. Any move is better than no move. And even fidgeting is a good way of exercising, right? It's actually spend a lot of energy by fidgeting. And if you're standing on the underground, you can do exercise by standing on one leg. It's actually very good exercise.
There is now some evidence out there to show that nutritional state, body composition at the time of diagnosis of even early stage cancer can have impact on long-term outcomes in some cancers, but particularly breast cancer.
In 2014, we went out to a group of patients and asked them about their experiences of nutrition and cancer. And rather sadly, pretty much all of them said that they got little or no nutritional care.
If our patients aren't aware of the link between lifestyle and cancer, then they actually wonder, what on earth are we getting at?
In the meantime, there are some things that patients could be told or could be advised. And one example, as mentioned before, was obesity. Patients with obesity who have breast cancer have increased risk of poor survival.
That the more people adhere to our cancer prevention recommendations, the more they reduce the risk of cancer, and the more they reduce the risk of dying. This is compelling evidence for governments and an incentive for them in order to create environments that are conducive for people and communities to follow our cancer prevention recommendations.
the food industry was set a voluntary target to reduce the sugar content by 5% in the first year. And the companies failed to achieve that target. They reduced on average the sugar by just 2%.
So I look at the World Cancer Research Fund report as a gold mine for us. And I would only wish that the other NCDs would have a similar comprehensive systematic reviews as this one.
Well, we've heard a lot today about how important the environment is. And of course, policy has shown to be an effective way of modify the environment and make it easier for the individual to make the healthier choice, the easy choice.
I think we need to carry on pursuing the public health agenda and persuading the governments to take action, but we can also reposition the argument, reframe the argument in terms of different objectives. So we can frame it in terms of climate action, we can frame it in terms of technology and innovation. So although the food industry sometimes can be part of the problem, they also can be part of the solution.
Our latest cancer prevention report, building on the reports from 1997 and 2007, now presents overwhelming evidence that changing behaviour to improve our diet, to regulate body weight, and to maintain physical activity can have a significant impact on our risk of cancer. It is estimated that 40% of cancers are preventable. 8 million cancer cases each year globally. It's worth fighting for.